Spinal electrical stimulation is a novel approach in treating children with spina bifida and other neurologic injuries. I'm placing 2 electrodes directly over the spinal cord, and my other 2 electrodes are placed wherever I need the activation most. When I'm activating the power, the child gets all straight with his spine. Or here I'm having electrodes on his back and his inner thighs, and when I'm activating the powers, his legs come together, and then when I let go of the activation, his legs go back into abduction. This is a 2-year-old child with level L for spina bifida. You've seen before, and this is after 3 months, and this is without activation, and this is with activation. Here you're seeing a 3.5-year-old child with level L2 spina bifida. The only active movement she has is flexing her right hip up. So the other advantages of spinal electrical stimulation are increased circulation, increased sensation, and some children have gained bowel and bladder control. So again, this is this child when we started, and she basically needed to have every single joint locked out in order to function. Here you see her during our activation. So we have electrodes on her spine and on her quadriceps, and she was quite excited to see her legs extend because she has never been able to do that voluntarily or involuntarily. Here you see her 8 weeks later, and she had gained control of her adductor muscle on the left and could move it on request. And you see her showing knee extension by herself. So we have gained new movements that she had never been able to access before. So the goal is to initially see it during stimulation, and then often movements happen spontaneously, and then they happen voluntarily. This child is 21 months old and has thoracic level spina bifida at T9. So here you see him on the first day of therapy. We put electrodes over his spine and on his adductor muscles, and you can see he was quite excited to see how his legs were moving. Actively, he doesn't have any movements that he can access. And then I placed electrodes on his abdominals and his spine, and you see I'm going to get a lot of hip flexors on the right. So this is me having the activation on, and you see how I can get a sustained muscle contraction while I'm activating the power. And then when I let go, his leg goes back in the original position. This is a typical sitting position for a child who does not have hip control. She has to keep her hands on the ground because she can't actively push her legs into the ground to sit up taller. She has level L1 spina bifida. Here you see her 5 months later, and she has gained hip control. She can sit tall, and she has even enough balance to lift her hands up and above her head. At 2.5 years old, this child was unable to bear any weight on her legs. She has level L3 spina bifida, and despite a lot of other therapies, just didn't make any progress with her standing. Spinal electrical stimulation is done by the parents at home. So the therapist selects the muscles that need to be stimulated. And here you see her at a typical session with her mother. Electrodes are on her gluteus muscles and on her spine, and she is standing and watching movies. So if possible, I like to have the stimulation while the child is in function, but it can also be done while the child is eating or being in the car. Here you see her another 2 months later, and she's actually starting to walk with her walker. Foot placement looks pretty good, and I can activate how much extension or external rotation I want to have on the legs. At 6 years old, this child has practiced crawling pretty much all his life. The problem is he can't activate his adductor muscles, and he really has to put in a lot of effort to flex his hips. Now you're gonna see him 3 months later. So the parents were able to do spinal electrical stimulation 30 minutes 2 times a day while he was sitting in his car seat on the way to school and on the way back from school. So we never practiced crawling, but because he was able to activate those muscles, he is really much more successful with his crawling. This is another 2 months later, and you can see how close his legs have gotten.